For over 30 years, the Subconscious Restructuring protocol has measured clinical outcomes on a session-by-session basis. In behavioral health, this is an anomaly. Most therapeutic approaches do not actively track patient results after every individual visit. Progress is often estimated rather than quantified. Since 1990, this protocol has operated differently. No diagnostic labels, no required medication, just continuous, standardized measurement. When you take abstract emotional states and submit them to rigid, continuous tracking, the chaos of behavioral symptoms is quantified into an organized, mathematical structure. Without session-level tracking, providers and patients are left to guess whether a treatment is actually working. Objective data removes the guesswork, holding the protocol accountable to actual, measurable results. This chart maps 17 psychometric measures of mental and emotional health from 5 clinical studies. The findings are divided into 3 cohorts: 40 adults, 40 veterans, and 10 adolescents. Every data point comes from client-generated instruments, reflecting direct patient feedback, bypassing subjective interpretation. By organizing thousands of individual responses into a single standardized dataset, unpredictable psychological conditions become actionable, quantifiable medical evidence. We look first at the adults and veterans. Combined, these 2 cohorts represent 80 participants undergoing multi-session treatment. This diagram isolates those 2 demographics. Across almost all 17 measured categories, both groups show consistent positive gains. Look at the more severe conditions. For depression, the adult cohort sees a 39% improvement, and veterans follow closely at 38%. On the measure of hopelessness, both adults and veterans record an identical 42% gain. The upward trends continue across anxiety, negative self-talk, and overall self-esteem, with all 3 metrics moving substantially in the right direction. There is also a distinct operational improvement here. In the veteran cohort specifically, sleep improves by 36%. When treating larger sample sizes over multiple sessions, the results demonstrate a predictable, steady stabilization of severe psychological symptoms, rather than isolated temporary wins. Sitting among these individual categories is the central tracking mechanism of the protocol, the stress load index. This is a derived composite score, built directly from the protocol's other instruments. It is not a single standardized test taken on its own. By aggregating the other measures, it acts as a macro indicator, and it moves reliably in the exact same positive direction as the individual symptoms beneath it. Returning to our source chart, the stress load index improves by 29% for the adult cohort and 30% for the veterans. Evaluating a derived composite index provides a far more accurate assessment of a patient's total physiological and mental burden than reading any single symptom checklist in isolation. The data behaves differently in early treatment. The final cohort illustrates the high variance and turbulence typical of a new therapeutic intervention. This adolescent group is a small study, consisting of just 10 participants. Furthermore, these numbers were recorded after a single 4-hour session. Statistically, small samples swing widely. That volatility is expected when measuring a brief initial exposure to any new protocol. We see massive positive spikes in this group. Anger improves by 49%, and the emotional state of love jumps by 46%, but 2 measures drop sharply. Hopelessness regresses by 37%. And relationship satisfaction slips by 2%. These wild statistical swings are exactly how preliminary data operates. It shows why 10 clients in a single session produce promising, but volatile numbers, and why sustained treatment is required to lock in long-term stability. Stepping back, we can view the entire picture, the unvarnished data across all 3 cohorts. The value here does not rely on a single flawless metric. It rests on the broad, consistent behavioral patterns revealed across thousands of data points. A methodology that rigorously measures every session, reports the sharp regressions exactly as they are, and lets the sustained outcomes speak for themselves is uncommon in this field. Clinical progress cannot simply be inferred. It must be measured. And when it is, it establishes a strict standard for accountability in behavioral health.